larger screen, and this is the initial picture which you will get if the camera is not connected. Here various functions. Here if you can see, once we press it once, you can see the various colors which I can just go to: brightness, contrast, then various other effects which we can get to and change them according to our requirement. So press it again and you can go press, so you can select that, and once you want to exit, then again we have rotated it. You can see if I rotate it, the combine itself, you can directly go to the brightness also. It's written here brightness, and they have also supplied some specialities with which pre-fed data will be there, and you can do that. And this is for the PIP, picture in picture, if you are having two cameras attached. Irrigation pump, this is for the hystromat. We are using it for controlling the pressure when we are doing the hysteroscopy inside the uterine cavity. So if you see here, we have a motor, and onto this motor, so this senses how much water is flowing through the tubings, which is, and these are the various pressures which are displayed on the screen. Normally we keep the pressure of the procedure when we are doing it to around 100. If you press, it goes to 100, and you can change it, the pressure inside the uterine cavity, and then you can change the flow rate and lattice coordinate. So we can increase or decrease depending on our preference. So the maximum is 1 liter, and then this will show the actual flow rates. This is the start and the stop button for the fluid. So this normally we keep it at around 100 because that is the mean arterial pressure of the patient, and at this pressure minimum amount of fluid absorption is there. Camera, and we can change the there are these preset settings for the camera. You can change it to various options: Laparoscopic and Laparoscopic. There is a microscope. So like that we can change, and we can get the best views. Here you can see that we have the multi-pin socket for connecting the camera head. This is the camera head, which is protected by a cover on top. And the tip also has multiple pins which will go into the and fit here. So when it is taken out, it's taken out straight, not rotated. It should not. This is the on and off switch for the camera. And the first thing that we do is WB is white balancing. So white balancing is done if we change the telescope, or the first time that we put the camera on. So we can white balance for the telescope that we are using, and then it will be fixed in the camera. So we point the scope towards the white gauze piece, and then till the white balance shows it is done, we keep it pointing towards it with our optimal light. And once we are doing the white balancing, gauze piece should not be in the view of the ambient light from the OT or from the overhead lights. And again, in the light source we have the on and off button here, and this is the LED. Nowadays we are using LED light sources because they emit less heat. The bulb of the LED light source lasts almost 50,000 hours, and that way it is less expensive to maintain, and it also heats up the lenses of the telescope less. Chances of burn to the patient is also less, so we can reduce or increase or decrease the intensity in use, we put it on standby so that patient doesn't get burned, and we still maintain minimum lighting, and as soon as we put the standby button off, we get the light. So on the light source you can see that the light cable connection is there. Electrosurgical unit is a very important part of the laparoscopy hardware, because a lot of things are being done using electricity. Now our reliance on monopolar has almost reduced. So here if you see the programs, we can preset the program for each surgery. Then we have the monopolar bi-cut. So that means we can use bipolar cutting facility under saline using this counter. And then we have the monopolar bicoagulation and bipolar in-seal. The bipolar in-seal means that there is a feedback. So this is a feedback machine, whereby the bipolar that you are using, and when you keep the tissue together, once the coagulation is done, automatically it will stop. So this is a safety mechanism which is there built in the bipolar, which was initially not there. So the same amount of current would come to the bipolar and the tissue would overburn or will char. Here that problem is not there. So here are the various sockets, which it's a metal pad made of silicone. It is pliable, black in color because of the silicone, and this is kept under the thigh if the patient is in lithotic position, and under the back if the patient is lying straight, and strapped to the thigh or to the patient for monopolar use. And this is the cord which is coming from the camera and connecting to one system called Dazzle. So this is one of the cards which will transmit the images or the video from the camera directly into the into your computer. You can see here the computer, and then we can take the images and record them on the system, the software which is provided along with the hardware. So this recording system is very, very important nowadays to keep a record of all the patients, and by law actually only the photographs should be given to the patient, as Supreme Court judgment states that the videos should not be distributed. They should be given only for education purpose, but the pictures can be given to the patient.